Let's bring in Ikechi Uko, who's a tourism and travel expert. Thank you so much for joining us this morning. Well, you listen to the Minister of Health there. Some countries have imposed entry bans from these endemic countries. Some countries like Nigeria is putting measures such as quarantine and travel advisories for their own citizens going to those countries. Do you think that this is a step to take? You heard him. It is not a time to panic. There's already self-restriction, there's already enough pressure on the economy and on the travel industry.
I thank you for having me up on your side today. I think the minister had properly put things in perspective. When there is a problem like this, knee-jerk reactions get wrong results. So you have to look at the experiences you've had in the past, what is working in some places, and what needs to be done. There is no direct flight between Nigeria and Iran. There is no direct flight between Nigeria and South Korea. There is no direct flight between Nigeria and China. There was a direct flight between Nigeria and Italy, but the airline packed up 2 months ago. So when people talk about travel bans or you want to stop flights, how do you stop flights between countries that you don't have direct flights with? Or like America has done, everybody is going to UK to travel from UK to US. And everybody is going to Ireland too. So what did you achieve? Italy tried to do lockdown some parts of the country. The day they announced it, the trains were full because everybody was going to the southern part of Italy. Then the government now says, okay, lockdown everywhere. People will still go for other places. Nobody wants to stay and die. If you're healthy and there is a quarantine in your place or a lockdown, and you look at the stats, and you know that the people who stay behind have more chances of dying, you try to escape. And that's why we have more than 100 cases in Africa who came from Europe. Your chances of surviving probably outside Italy is higher than if you stayed back. So I'm happy that the minister made those points. There is no need to impose any travel ban. Contact tracing, management. Like Obama would say, follow the science. What has worked? At the beginning of this crisis, I heard the president of, I think, Prime Minister of Canada, says, no, we're not going to do any of those. We had an experience with SARS. We knew the price we paid
for that.
And we will learn from that experience. We are not going to impose any of those drastic things. So there is something the minister said in his own way, that in travel business is, we call it now ghost planes. You see an aircraft that has only one passenger. So it flew with passengers to a place, somebody tested positive, so the aircraft can't be allowed to carry passengers back.
Okay. Okay, I just want to bring in this, because part of the minister's briefing was a very cheering news that the index case started testing negative, and you know how the drill is. Once you can have
the contact with the
index case, once you can have 2 negative tests, then they're set to go. They test the first one negative, they can have the second confirmatory negative test, and then we're set to go. That good story, that good news, coming on the heels of, you know, what the travel industry is starting to face as a result of this. Like you talked about how this has sort of like impinged on profits in the travel sector all over the world.
That word has disappeared now. Nobody is making profit now. It's a disaster. We are $25 billion to be wiped off in 30 days between American airlines and European carriers. And $130 billion lost altogether. Massive events are being cancelled. Nigeria is lucky. We've been blessed from our experiences. We've managed the crisis well. The communication is on point. Contact tracing very well done. Management of the patients has been handled well. So we will not suffer a lot of it. Lagos, traffic out of Lagos airport, still good, but Abuja is in decline. And effects are beginning to seep in, and it might be osmotic, take time to hit us about the impact of this. But the global travel business is...
I'm excited you talked about the automotive. So sorry about that. I'm excited you talk about that real quickly. Isn't this time to look inward? Like sort of like have a diffusion in the holiday market. Cheta, just add your question on that. And
I mean, I'd like to talk about testing because you, like the minister and you have rightfully said, it's not a time to panic. It's not a time to ban, people from coming in from different parts of the world. However, looking at what the Senegal government have been able to do, they're partnering with the UK lab right now to produce a test a coronavirus test that can be done in 10 minutes. Isn't that what the Ministry of Health should be focusing on now? To make sure that people that are coming in are getting tested faster so that it doesn't, disrupt the travelers coming in. It's really because the symptoms themselves can be seen in all cases.
Okay. Testing and travel looking inwards.
Okay, I'll do the testing, then I'll talk about it. For the testing part of it, we know where the problem will come from. We targeted at those places. We are probably going to get all sick people tracked within the first 4 days. We've been successful at doing that. Where those things failed, where they couldn't get the index patients in the first 4 days, the system went crazy. But we've been successful in that. Most African countries have so far been successful in tracking index patients. So I think the testing part isn't our problem. For the travel part, yes, this is the time to redirect our efforts. And the travel and tour operators are already having that thinking. Nobody is sending passengers to places where there are cases, but I still know people want to travel. But people now will travel within Africa. So Africa will be the first beneficiary of that. Now we need to now turn it around. Nigeria is the biggest place for people to visit in Africa. How do we take advantage of this? That is the discussion going on amongst us in travel business. The biggest problem for us isn't coronavirus. It's the fact that most of our destinations cannot be accessed, not because of infrastructure, but because of security. So people will only do Lagos and around, and probably cross river, Ikechi State. And so just tour operators in Nigeria are being restricted to just 3 or 4 states. So now is an opportunity for us to take advantage of this thing and grow our tourism. But where do we take them to that everybody is safe to go?
Indeed, it is important to reiterate that in the course of the briefing by Nigeria's Minister of Health, it has been revealed that Nigeria's second coronavirus case has now tested negative. He had contact with the index case in Ogun State, although he did not develop symptoms, but he tested positive at that time. Now, the minister has now said he has tested negative. We're just waiting for a confirmation test again. And so Nigeria may just be looking at, one more case, and the index case himself has been recovering in stable condition. But let me ask you, because, the travel industry and the tourism industry in Nigeria has always punched below its weight anyways before now. But what can we do to shield the industry? And what sector would be hit the hardest? Is it travel? Is it business conferences? Is it religious tourism? Which of the sectors would be hardest hit?
Okay, we never had leisure, except in December. The dirty December and Carnival Calabar was a massive something news for us in the travel industry. Then the obligatory travel has always been Nigerians' best opportunity to do tourism, which is the meetings, incentive, conferences, and exhibitions. We call it MICE. And religious tourism ranks very high. So we've always done well with religious tourism here. Actually, it's our #1 income earner for tourism. So this is the time when people are scared of their lives. Everybody thinks they're going to...
Hope they'll be trooping in to come and cure coronavirus in Nigeria.
Medical tourism.
It's good business for us.
Medical tourism.
They are all
Because
coming
they're seen as a religious country.
Yeah, I know the Korean case was a Christian cult, or sect, sorry. So there's a danger in that. But it's an opportunity if our contact tracing, our screening projects are on speed. I think we should take advantage of it. This is the time for our religious tourism, business to go
But
global.
even in the thick of the coronavirus, we had a major religious gathering in the course of last week or thereabout, and there was a synergy, between the health authorities, because I heard that the health authorities did go there.
Then we should do more of that.
And so
This
the
is the
religious
time.
gathering are sort of like safe now.
This is the time to offer healing to the world. This is the best time.
Let's not send the wrong signal with everybody trooping
I
in
mean,
here.
Kakao was here yesterday, so but real quickly, I want to take you up on this. What are the measures being put in place by the federal government to help tour operators cash in on this new big deal?
I don't know of any.
Where we're looking
I don't know
inwards.
of any.
What can they do?
If you could suggest them.
See, when there's a crisis like this and you want to take advantage of it, the first thing is, like we're just doing now, what can we do to take advantage of it? The Ghana Tourism Authority had a meeting with the stakeholders yesterday, and the hotel says we are having lots of cancellation. All the international conferences. Ghana is #1 in meetings and incentives in West Africa. So that means we are losing that. What do we do? They're having another meeting on Monday, and I'll tell you what they're likely to do, target Nigeria. So as a way of trying to get back those beds. So what will the government of Nigeria be willing to do? We are listening to the health people. They are asking for money. They are not getting the money. And this is a matter of life and death. So if you don't give the Ministry of Health and CDC the money they need, will they give to tour operators and airlines who really need it? We'll be happy to have that kind of conversation going.
Well, thank you so much for coming on the show this morning, Mr. Ikechi Uko, and for sharing your thoughts. Again, Nigeria's second COVID-19 case has tested negative. We'll bring you development as it unfolds as regards that case, but that brings us to the end of the show today.